Good evening. Before we get started with our questions, I'm going to have the panelists introduce themselves and their organization. So I'm going to start on this side with Solomon.
Yeah. Good evening, everyone. My name is Solomon Ayalew. I'm the DMV Director for African Communities Together. African Communities Together is an organization that's based in New York, but we have our chapters in Philly and the DMV. What we do is we work to organize African communities around their local, state, and federal issues. As many of our communities are very good about showing out for their home countries and whenever there's issues occurring there, but showing out also for their new homes, their adopted homes here, showing up for the PTA meetings, the various things happening at City Council, all of that with their concerns and helping them to communicate them in a way that they feel heard and understood. So we do a lot of electoral work. We do a lot of legal services for immigrants, free legal service for immigrants from our chapter. And we just generally trying to get our African communities to be engaged around the civic issues that they're facing day to day.
My name is Moe Bryant. I'm the Executive Director of Challenging Racism. And for 20 years, Challenging Racism has been focused on creating brave spaces for people to learn together, to talk about race and racism in a real way, to talk about systemic inequities in a truthful manner, and talk about true history. Mental health is central to this mission because when racism and systemic inequities go unaddressed, it takes a direct toll on our overall well-being. Our mission is to empower and inspire individuals to be courageous and to not be silent, to make sure that they can interrupt racism and systemic inequities as they see them.
Hello everyone. My name is Zulemy Loza, and I'm a case manager with United Community. So I'm going to speak about United Community. United Community is a social service organization with over 50 years of experience working along the Route 1 corridor. Our vision is to end multi-generational poverty by creating equitable opportunities and community-based solutions. So we have a variety of programs that their overall goal is to help individuals work towards self-sufficiency. So thank you.
Hello everyone, my name is Jaylene Matias. I'm also a case manager at United Community. More specifically, one of the programs at United Community is the Family Achievement Program. And basically, as the case managers, what we do is we strive towards helping low-income families strive towards self-sufficiency and independency. So with that, we usually work with them on educational goals, employment goals, and provide wraparound case management, which mental health, childcare, any barriers that they might face that prevent them from being their most successful self, we try to give them the solutions and resources to overcome those.
Hello everybody, my name is Hyun Sun Park. I'm the Director of Health Services at KCSC, Korean Community Service Center of Greater Washington. We have been serving the Asian immigrants in DC metro area for over 50 years. What we do is helping with their social services and health services, and we do have victim support services. And we are representing, I'm honored to be here with all of you representing one of the Asian immigrants. I'm very nervous. I'm representing one of the immigrants with the language barrier. So yeah, I'm honored to share my experience and our organization's mission and vision tonight. Thank you.
Thank you. We have a wide range of communities represented here, and I'm excited to hear your experiences. So for my first question, as we heard from our keynote speaker, J.D. Spain, mental health is deeply personal, but it's also shaped by policy, culture, and history. How do you think identity and community shape your understanding of mental health and those in your community?
Okay, there we go. So I come from Ethiopian and Eritrea background. I was born in Ethiopia, and I'll say your culture and your background influences pretty much your entire view of how mental health can work. For example, coming from a society that's more collectivist versus individual, for me, a lot of what constitutes mental health and therapy includes my community and my family and staying engaged and working with them through my issues. That doesn't necessarily mean not to get professional help, of course, but that is a big part of just coming from a country that has that as their focus, is having community at the center of every approach. So I think it's pretty much the lens that you look at mental health through.
In the Black community, and let me say this, that no one subset or one group is a monolith. So I speak for myself, but many of the systemic challenges that we see have intersectionality amongst many communities. As our county board member, J.D. Spain, was saying, oftentimes in the Black community, we are taught that being strong is the answer to mental health, that vulnerability is a taboo, that we should keep things in the family, we shouldn't air our laundry. Also, as he mentioned, many faith communities, it is taught to the preacher or the priest or pray about it, and not having the intersectionality to dialogue and discuss that along with faith and along with faith leaders, there is strength in finding an appropriate mental health individual, that you cannot navigate a mental health crisis or behavioral crisis alone.
So I identify, can you guys hear me good or no? I identify as a first generation Latina. So I come from a background of overcoming challenges, whether it be moving to a new country, learning a new language, going into a new field that you haven't been in before. So that has shaped me into being an advocate to the community and to the people that I work for, so they can also overcome the challenges that prevent them from seeking mental health services.
Hello. I also represent the Latino community, and I would say for me, speaking from personal experience, my understanding of mental health, at least when I was younger, made me feel almost like ashamed, or it gave me like a shaming feeling, because it's not something that we talk about. It's something that, it stays at home, or it's in your head. You just have to keep going. And from my perspective, I'm a second generational born here in the U.S. So I've gotten to see things change through generations, whereas my mom struggled through things similar to what Zulemy said, but now I'm seeing a different perspective because she's showing me the way. But on the same side of that, there's still people like, for example, my father, who has that mentality still that, mental health is something that you just have to push through. So it's definitely something that's still misunderstood, but I feel like in the Latino community, it's something we're still working towards understanding.
Working at KCC, I was doing talking about mental health itself, often avoided from our Asian community because we value on endurance.
Yeah, in Asian community, our culture value highly on endurance. Okay, so parents teach the kids endure everything, and endurance is the priority. And also we value on the family reputation. So usually we just hide personal struggles and not counsel with the experts. So we focus on establishing the trust first. So we are focusing on establishing the safe space for open conversation for the community. So for a long time, KCSC managed with the transparency and build the trust in the community. That's why more and more people, I think, seek for help at KCSC.
Thank you. So some of you touched on this topic in the last question, but what are some common barriers to talking about or seeking mental health in your communities?
There's many barriers, as we know, so I'll talk about one of the barriers. I think one of the barriers is lack of financial resources. A lot of our people in our community are uninsured, or they're in survival mode, so they're struggling to make ends meet, so they're more focused on meeting their basic needs. So mental health just kind of takes the back burner. So one of the barriers for that I want to speak about is lack of financial resources.
I'll just add on to that layered with that inaccessibility is the distrust of systems from systemic racism, where care has historically been inaccessible, ineffective, marginalized, and harmful language, harmful practices, and not culturally relevant. To add to that is that we are understaffed with culturally competent providers. In my personal life, looking for a provider for friends or children, it is very, very difficult to find an accessible doctor that has even availability within a year, that understands what systemic racism, how it plays a factor in our mental health and our well-being. And then when you do actually get an appointment, it's very, very hard to find follow-up care. So just adding to that.
I would add language access is a huge issue. So just like culture being such an important lens that we see mental health through, language is just as important, and they're very interconnected. In my culture, in my language, for example, we don't have a word for depression. We have other words that could work, but those also carry very different contexts and meanings to them. And so because of that, when one of our community members is going to a mental health professional, and if the translation's off, or if there isn't somewhere there that can speak that language in any capacity, they could be hearing a completely different set of, help or advice or treatment than what they might need. And mental health is a moving target. It's not like a fixed location. So having a professional that isn't able to speak your language, or there's no one there to help translate it, just makes that journey way more difficult, and oftentimes can lead to the wrong places or wrong conclusions in that person's head.
I'd like to mention the generational gap in a lot of Asian families, even like from the first generation, second generation, and the third generation. There are a lot of gaps because of the language barrier. The first generation probably speaking in fully Korean, and the 1.5 or second generation speaking in Korean and English, and third generation only speaking English. So because of the language barrier and cultural barrier, they cannot properly communicate and understand each other, even in the family. So often we need a systematic change inside the family system, but it's very hard to be addressed because of the type of gaps.
Thank you. I loved in your intro how you said that your experiences have turned you into an advocate. So if you had the ear of every policymaker in Northern Virginia, what's one change you would demand to make mental health care more equitable and effective for BIPOC communities?
Fund and have a pipeline for BIPOC therapists. Our young people, our young adults need to see themselves when they go to the doctor, which means they need to see doctors that look like them, which means they need to have funding and pipelines at their schools. We also have to believe lived experience. Also, it's making sure that, as we said earlier, that these programs are funded, that it is an open conversation, that we remove the stigma from talking about mental health.
I would say investing in more certified community behavioral health clinics, and having more, thinking about language, like what I mentioned earlier, thinking about language access when you're thinking about funding for mental health. Because again, if we're not able to understand, then it makes it already, it's not going to be helpful, especially if you're talking about for that those specific communities that need it.
Earlier, I spoke about how there's lack of financial resources to seek mental health services. A lot of people are uninsured or their insurance coverage is not enough. So if I had the ear of every policymaker in Northern Virginia, I would advocate for increased coverage for Medicaid and private insurance for mental health services, as well as increased sliding scales, more mental health practices to use sliding scale for those individuals that have no insurance.
Kind of like what we mentioned already too, I feel like another big thing is the accessibility. I think it's important that we meet our clients and our families where they're at. I feel like it doesn't just have to be a doctor's office or virtual. I like how you mentioned like maybe in the schools, maybe at church, faith is important to a lot of communities, and just like going to them instead of having them find us all the time.
Yeah, I would like to mention the education at school, like not only for the students but also for the teachers. A lot of like young folks spend a lot of time with their like teachers. But what if like teachers are not well educated on what's to understand what's trauma? Informed care, it can be kind of like another barrier for students to be empowered on mental health. So I would like to emphasize on the education for the teachers as well.
Thank you. As J.D. Spain mentioned earlier, across the Northern Virginia region and also the nation, we have a crisis. There's a lot going on, and in the BIPOC community, there are microaggressions and also everyday racism. Can you offer tips on how to best manage the mental health aspects of microaggression and racism? In less than 2 minutes, thanks. Oh, sorry.
It's such a tough question for everything that's going on right now. At least for me, I mean, so right now I'm a case manager, and we do have clients that don't have legal status and things of that nature. So with the climate going on right now, that is like a big thing, microaggressions, racism, just that fear of like the government and things of that sort. My advice to them is to know first like their rights, that they have their right to speak up for themselves, but also to try to set boundaries, to also try to like be calm and just like be proud of like who they are. I feel like sometimes we can get lost in the microaggressions and we lose like our identity because something stems from that other person who's reacting to us that way. So I just try to like comfort them and encourage them to speak to others about it who are going through the same thing, so they can share and also feel like they're not alone.
Going off of what Jaylene was saying, I think it's important to validate the experience. Say it's a family member, a friend, a coworker, whoever it is. If they go to you and they say like, this happened to me, I think it's important to validate that experience so they feel heard, they feel seen, as well as also talk about self-care. Jay talked about it a little bit in the sense that it's important to take care of yourself. And like validate that experience as well, like remove yourself from a situation or include yourself in a situation you feel like you can handle it. But that would be my recommendation.
I had to take a big breath for that one. I was looking at Rebecca when she said it. So just for everyone, micro and macro aggressions are sometimes the unintentional harms that come our way through sayings like, oh, you speak so well, or you're so pretty for a brown girl. All of the little things that maybe we hear. I'm going to keep it under 2 minutes. And I'm going to use something that I used at a panel earlier this year, because many of us experience these, and I see a lot of my partners here from DHS and other organizations. We all can remember our ABCs, right? We have to be courageous enough to acknowledge when we're not okay, when we hear something that was not okay and that was said. Then we have to take a deep breath so that we don't fly off the handle. I'm speaking for myself. But we have to take a deep breath so that we can figure out and determine if it's intent versus impact, and if we need to call someone out or call someone in. but it's not our job to always educate someone for what it is. And then we need to make sure that we stay connected with people that we care about, that see the pain, that see the things that are happening, especially right now in this climate. So our ABCs, we need to acknowledge, we need to breathe, and we need to stay connected.
Heavy emphasis on breathing. Take a breather. That's always what I have to do for myself. I have to go for a walk sometimes too, depending. But honestly, the next 3 years, I don't really think there's going to be microaggressions. It's just going to be all aggression. It's full court. Yeah, it's just aggressive right now. And so I think it's important to remember that it's a marathon, that we have a long 3 years ahead of us, and especially for those that come from marginalized communities or serve marginalized communities. And with that being the case, like with my team, I'm very upfront about encouraging them to share whatever's going on in their life and giving people some time to breathe through it and work through it. I think it's just, when you're thinking about like the work that our organization does, a lot of organizing work, a lot of grassroots community work, it's not 9 to 5 to begin with. A lot of times we're at an event on the weekend, or we're showing up for some, late, something like this. And with that being the case, like as supervisors, as managers, as directors, people that are managing people through this work, it's really, really important to understand what burnout is, what the signs of burnout is, and helping our teams get through that. And my biggest thing has been I'm very frank with my team. If you're not having a good day, if you're really, really having one of those days that you just cannot make it through and you're having trouble with stuff, let me know, and we'll take a half day. We'll get to the work tomorrow, because again, the next 3 years is a marathon. There's really not gonna be any short of fires to put out. It's just gonna be one big forest fire. So take it easy, get your pail of water, and take a breath and get to work. That's all you can really do.
I like that reminder to rest, right? Rest and joy can be a resistance as well. So switching gears a little bit, what is working right now in terms of mental health support in the communities that you live and serve?
Okay, I don't want to hog the mic, but I really love our community. When I said I'm looking around the room, JD mentioned earlier the sheriff, and we've worked personally challenging racism and know that there are programs happening to change outcomes, because that's really how we make a change. The county has invested funds and is making sure DHS is fully funded. Then I swing over here, and I know my sister Tiffany with the Marcus Alert. If you don't know what the Marcus Alert is, please look it up. We should all know. That allows 988 calls to be rerouted so that mental health individuals or professionals respond to the call with our emergency professionals, our first responders, to make sure that someone that is in a mental health crisis or that has a disability, that autism or might be non-speaking, that they have the right services. There are so many things happening here. There are SEL, social emotional learning lessons happening in our schools. I truly believe, and this is not a plug for Arlington, but it is, that we are really leading the way with a number of things and how they intersect to benefit the community.
I think we touched on it a little earlier, but we said that mental health is heavily stigmatized in the Latino community. However, in the Latino community, faith is very important. So something that I've seen is working is partnering with faith-based communities from different denominations and having their leaders encourage the congregation to seek services, as well as guide them or have services done directly in the church if it's acceptable. Like, I feel like partnering with faith-based organization is something that's really working right now.
I would like to share my experience working with our next-gen young folks. Rather than teaching directly about the mental wellness for the youth, we offer a lot of volunteering opportunity and cultural events to get together and build trust and confidence together. So after several months working on community services and a lot of experience a lot of cultural events, they feel confident to share their thoughts and struggles with each other and get to know more about KCSC program, our organization's program, and easily connected with the mental health support or other opportunity to be educated on mental wellness. So that's our strategy working well now.
I definitely agree with the working with faith-based leaders. It's extremely important, especially if you know your community's faith-oriented, that to get the faith leaders on board with trying to have these conversations more directly in their congregations. I wasn't the one to design the program, but in our organization, we also do like group therapy sessions, and what that looks like oftentimes is bringing people. So we have a hair braiders campaign, which is where we brought together African women that have a skill for hair braiding and helped them with getting starting up a small business using that skill. And a part of that is that we have group like just sessions to talk about whatever's been going on in their life, and we don't frame it necessarily as like direct therapy, as direct mental health, but it's an opportunity to just talk about what's bothering them, impacting them, while in tandem having membership meetings where we do talk about mental health directly, and hopefully people kind of connect those dots and in their own lives. Yeah, I found that with cultures that are very, again, collectivist session, like group therapy, or being able to talk about it and see other people in your country or your community deep going through that experience is really powerful.
Yeah, I like that idea of using the safe spaces that communities already have and building on that. We are sitting at a school right now. What advice can you offer educators on their role in supporting the mental well-being of BIPOC children and youth?
Since I have the mic, I guess I'll start. I think that educators are like the frontline workers. They spend most of the time with our children, with our youth. So as educators, I think it's important to educate yourself on racism, on everything that's going on, how you can be an advocate for your students. It's important to create a safe space in your classrooms, normalize mental health challenges, and intervene when possible.
I'm just gonna continue off of that too. I feel like for me, something that I've noticed is that I think, at least for the Latino community, I think my advice would be just to be mindful. I think sometimes we'll see children or youth or adolescents and we just see them as children or we just see them as kids, but I think sometimes we forget that there's a lot of other things that go on at home. At least from my experience, there's a lot of Latino children that are responsible for a lot of adult things when they get home. Some of them are caregivers, some of them help their parents work, some of them are translators for their parents. So I feel like we have to shift our mind a little bit on how we approach them, because a third grader that we see might be different from another third grader from a different community.
I would say we have to affirm our students' identities. We have to see them as their whole selves, not just a deficit or not just as a statistic. And yes, we know that is really hard right now to make sure that we have diverse curriculum and materials that reflect all of student bodies. And unfortunately, some of our educators feel like their hands are tied because of directives that are coming nationally, specifically in this county. But we have to stand by our values. They're stated. They're not just words on a paper, they're who we are. It's what makes us a community. Spaces like this with NAMI Northern Virginia, board members, people being involved and invested, we need to make sure that we're modeling it for our young people.
This one, it's a bit tough because I think if I were to say for educators, like if I was working with young people today, one thing I wish I had was given to me was a better understanding of just how to handle my parents' anxiety and depression, or even just being able to understand it and acknowledge that that's what that was. I think it's really easy when you're young to take everything that your parents or grown people in your life do as a very personal and individual and direct thing to you, when most times in reality it's a response to like the world being hard and very difficult, and especially in the context of immigrant parents having to take your kids from another country and bring them to another place and raise them in a completely different environment with culture, language, all that changing. And sometimes not even being able to communicate directly with your kids because they speak a different language than you. And so I think, again, I'm not an educator and I don't really have a good understanding of like how curriculums are developed, but if there's some way to structure or help young folk to understand what these things look like, so that they can navigate it for themselves and can understand how to be a source of help. I know if I was in high school and I was more aware of this stuff, this is things that I'd wanted to have been, would want to help my mom or my dad with as they were going through it themselves. So I think, that's probably the most first thing that comes to mind.
Thank you. So, as individuals, it might be scary for individuals to seek mental health support. So what recommendations do you have when folks with your shared identity from your community are identifying a mental health professional? What would you recommend that they seek out or do?
I guess I could speak from a case management point of view. That's often like a scary topic when meeting with clients. For example, at our organization, we do something called a psychosocial assessment, and it can be really intense because most of the time those questions are really invasive and they ask things that no one really wants to talk about on a daily basis. So for us, I guess as a case manager, I just try to like preface the conversation and like let them know what's to come, give them that opportunity to want to talk or not want to talk about the questions that I ask, but also like a big thing for our program is building rapport with the client. We want to get to know them. We want to know their stories, their struggles, so that way when we have those conversations, they're a lot more open. And we're really big on like meeting the client where they're at. So just opening the conversation, like instead of saying like, how's your mental health, or do you have mental health issues? Like we ask more questions like, how are you feeling? What's going on? Like try to get them to talk to us instead of coming off so strong. And then at least for us, we try to like, if they're willing to actually take the step to see someone, maybe I'll go with them. Maybe I'll help them research a provider and just kind of go along those steps on the journey.
So kind of going off of what Jaylene was saying, my recommendation for folks with my shared identity is for them to be vocal about what makes them feel comfortable, as well as like if you're the provider providing service, make sure you're being open, honest, you're seeing the client, meeting them where they are, because that's what makes them feel comfortable. And over time, and we also have to keep in mind that everything takes time nowadays, so the client might not be comfortable during the first session. It might take a couple sessions. So just sticking with them and knowing good things take time.
It can be a little different in answering, but I would like to emphasize on the community outreach by sharing one of my clients' story. When we conducted the seminar at a large Korean church, after the seminar, one lady came up to us requesting the support. Her story is that she has been abused by her husband over 50 years. But because of the Asian culture of endurance, right? Endure everything and don't share your struggle to keep your family reputation. She endured for over 50 years, but finally, after the seminar and education on mental health, she decided to share her struggles with the experts. So active community outreach sometimes make a big difference and a change in the community and everyone's life, I believe. So yeah, importance of community outreach.
I would just say that it is so brave and courageous to get support and to get the help you need. And I know that generally might be hard for many cultures, and to trust your instinct. It may not be the first person that you see or that you speak with, just because maybe they have a shared identity they oftentimes may not have the same lived experience. So if you trust your instinct, if it's not the right person, if you need to find someone else, do that. Trust yourself.
I think the best advice I'd give is, your therapist works for you. So be selfish when you're trying to figure out who your therapist is. I think at least I know my first 2 rounds of therapy, I wasn't putting as much time into the search process as I should have in terms of finding someone that not just fits my needs as, wanting like cognitive behavioral therapy and things of that nature, but also just like that they fit and they understand aspects of myself. And as you get to know yourself more, you also can learn different parts of yourself that need to be tended to, and that could require having a new therapist. And essentially, like, your therapist isn't like a lifetime appointment. You can have different people across your life. You can change as needed. And I think that's dispelling a lot of these thoughts around therapy is really important in our, especially when we're doing outreach work and getting communities to seek therapy. We should also be helping them to find where the portals are and understanding that search process, because oftentimes that first round, if it's not successful, people will not want to go back and not want to do another session. So helping them to get started by making sure the search process, the people take time and understand that better, I think is something that I would definitely consider if I was going to therapy or I was telling somebody for therapy the first time. And yeah, it's a lot of it is, there's just all these like little tips and advice you can give. Like, I think the endurance piece is a huge one of, people use resilience against you. Like, when they know you're a resilient person, they'll keep expecting you to be resilient, and so they'll justify not helping, they'll justify not supporting. We see this happen to so many Black communities, cultures, and like the universities, the HBCUs, for example. You hear them every time. Resilience, they're so resilient, they can handle everything with so little funding. And I'm like, give them more funding so they don't have to do that. But that's just how people see resilience. That's how they use endurance, is that they even in your own head, you'll use it against yourself and be like, if I could have endured this much, I can endure more. If I could deal with this much, I can keep going. So like dispelling these rumors and shedding some light on the rules that people make for themselves in the dark, because a lot of people make rules for themselves in the dark that no one ever told them. And so, yeah, finding ways to get into that deep work is important.
I like that. Be selfish, period, because this is your journey, this is your treatment, this is your healing. So for those listening today, what's one thing that they can do tomorrow to support mental health in their own families and communities?
Understand that you and your family deserve wellness in each and every way. Oftentimes we think about our physical health. You and your family, specifically you, deserve wellness.
Talk about your problems openly and candidly. I mean, again, not everybody. Like, if there's someone that's clearly the person in your life that you don't want to be sharing these things with, that's fine. But the person that you feel most comfortable to, just start talking about these problems. Get comfortable with vocalizing them. I forgot I said it earlier today, but like, let your mess become your message, essentially, and just like try your best to make sure that if you are bringing these conversations up, it makes it easier for someone later on to have that conversation with themselves even, or with others.
Earlier, Mr. J.D. Span said something that really resonated with me. He said, asking for help is a strength. So if you're listening today, if tomorrow you need to support someone that needs mental health, I would say let them know that asking for help is a strength. Encourage professional help when needed, as well as model healthy coping skills yourself.
Kind of going off what Solomon said, I feel like it's simple, but let's just talk about it. I feel like be an open ear for somebody else. If they have the courage to actually talk to you about it, listen to them, and just provide your friends, your family, anyone you know who's curious or wants to know more information and resources.
Yeah, the same. Be an active listener without judgment. Yeah, that's the beginning.
Thank you. So all of us on the stage are providers in some way. What do you wish mental health providers better understood about culturally responsive care?
I wish they would understand more that there's the things that can create the conditions for mental health issues in a group of people, a society or whatever. They're not obviously just individual. They're oftentimes products of like a lot of sickness in society as a whole, and problems in society as a whole. And so, for example, we had a member, one of our members last year, who we were helping with housing issues in Alexandria, and he was very housing insecure. Unfortunately, there wasn't as much we can help with the housing insecure, and then they committed suicide, and they didn't want to lose their home. And so this is an example of like these social issues of housing and how they directly connect into the person's mental health and their community. And so for me, I think mental health care providers need to be more present and be more present and be champions in these social issues that are creating this mass mental health crisis that we're dealing with across this country.
I think as providers, something that always sticks out to me since I'm a case manager, I work with families, is to ask and understand the family dynamics of each individual. Each individual's family dynamic can be different from another individual's family dynamic, as well as the family dynamic from culture to culture is very different. So my advice would be to understand, ask about everybody's family dynamic.
Similarly, something that just came to mind for me is that sometimes I feel like when you seek mental health and then your background, your culture, they don't always align. I feel like it's common in therapy to be told to set boundaries and things like that. But if you are familiar with the Latino household, you can't say no to your parents, or you can't just disagree with them. So I think just being mindful and aware of that, and that sometimes they just butt heads, and not all practices help everybody, and that they're not one size fits all.
More understanding about having the language barrier. Whenever I attend a conference, I share this story. When I talk with the county staff about the language service line, they told me, we do have excellent language access line. But then I told them, when actually majority of my clients cannot use your language access support line, because when they dial to, for example, 311 in Montgomery County, Maryland, they will start speaking in English to introduce the number of the other language, right? So press 1 English, press 2 Spanish, all other language, press 3. They cannot understand that explanation. So having language barrier is a fear. So more understanding, having difficulties, having language barrier, I would like to recast that.
+1.
I think many health professionals know this, but I hope that they remember that by the time someone gets to them to ask for help, how courageous and how brave they were to get there, and that they know that they get one shot to really welcome them into the space and to let them know that they're so courageous for asking for help. Because if we forget, you can change somebody's entire outcome.
Thank you. So I want to end our discussion talking about resilience, and you kind of touched on this, Solomon. But talk about a practice, belief, or strength from your culture, your community, that supports resilience among its individuals.
Well, that one's kind of easy. We historically and presently are a resilient people. We always have been, we always will be. I don't have much more to add to that.
I think for me, like what is one aspect, I mean, it's just the gatherings, all the like getting together for various cultural events, holidays, birthdays. I think for the music, the food, like there's so much joy that exists across our cultures that you can explore and engage and invest into. And I think that's honestly what has helped us to stay as resilient as we need to be, is that our food's great, our music's better, the people are great. So it's just like, I think that's the biggest thing is for me, is investing in the community and embedding myself in the community, or at least trying to engage with the cultural aspects of it that speak to what I grew up with.
I think a strength that all of our cultures have is that we're very strong-willed. Like, we'll cross the borders that we have to cross, we'll learn the language that we have to learn, we'll take the job that we have to take in order to provide for our family, provide for a better future. So it's important to apply that same strong-willed value to our mental health, to our physical health, to our families, to us as an individual. So I think that's what makes us all very resilient, that we're very strong-willed and determined to get what we want.
I feel like also it's like kind of what you said earlier. We're resilient. Is it because we have to? Is it because we don't have the funding to? Because we don't have the support that maybe other communities get? I feel like yes and no, it's that, but also I think we do really well in big numbers. We're willing to support each other, support other members in our community, and I feel like it's just that motivation and that determination to just want to do better, especially immigrant families that come over here wanting a better life for themselves. I feel like that also takes place into their resiliency.
Yeah. So it seems like we are resilient because we have to be, because of our ancestors have shown us that we can be, and drawing on that history I think is important as we move forward. Thank you so much to all of our panelists. I've really enjoyed hearing your experiences and your stories.